Abnormal semen means only one thing, and that is that when we do a semen analysis, some of the parameters come back abnormal. When we do a semen analysis, we look at motility, we look at morphology, and we look at count. In other words, we look at how many sperm a male produces per ejaculate, how well those sperm move, and how normal the sperm heads are. That's the morphology. The sperm has only one function, which is to fertilize the egg. It is obviously not ethical to take sperm and run it against somebody's eggs. So we cannot do that. We therefore do a semen analysis, because once all three parameters are normal, we can with 99% certainty assume that the function is normal as well. And in inverse, if one or more of these three parameters are abnormal, depending on the degree, it will tell us what the likelihood is that the sperm's function is also abnormal. A low sperm count is defined by smaller than expected numbers of sperm in a single ejaculate. Most frequently, the exit for the sperm is occluded, either from birth or sometimes through an infectious process that can scar up this exit tract. Or sometimes the male simply does not produce any sperm in his testes, which is a much bigger problem. Fortunately, in most cases of azoospermia, the male does produce sperm, and if he does, wherever that sperm is, we can find it. Either we find it in the testes, and through a mildly invasive surgical procedure called TESE, T-E-S-E, extract small amounts of sperm from the testis of the male and use that sperm then in IVF. Or in cases where the male retrograde ejaculates, this means that the sperm is produced in the testes, but on the way towards ejaculation is misdirected into the bladder rather than outwards. And this happens sometimes with scar tissue. In those cases, too, we can usually find small amounts of sperm in the bladder, in the urine, extract it and use it for IVF. So if sperm is produced, we usually can track it down and can use it in IVF, successfully allowing those males still to become the genetic fathers of their children. Indeed, in roughly 85% of azoospermia, absence of sperm in ejaculate, we still find sperm somewhere, enough to be successful in IVF.